Welcome back, everyone. Rejuvenate your skin without all the pain and downtime. Board-certified ophthalmologist and oculoplastic surgeon, Dr. Kenneth Neufeld is here today. He's with Thomas Eye Group Aesthetics to tell you how to take years off of your eyes. Welcome to the show. Thank you so much for being here.
It's a pleasure to be here. Thank you.
Well, the Thomas Eye Group reputation precedes you, so well respected in our community. So what does the aesthetic side do for us?
The aesthetics is an adjunct to the ophthalmology practice, and basically what I do is, as you said, oculoplastic surgery, which is a hybrid between ophthalmology and plastic surgery. So it allows me to concentrate on surgery, diseases, and reconstruction of the eyes while I don't do surgery anywhere else in the body, just around the eyes and the face. Specific things that we deal with very commonly: droopy eyelids, orbital tumors, and the orbit is the area around the eyes, eyelid malpositions, skin cancers, eye-watering problems, fractures, amongst other things. Additionally, we do Botox injections, dermal fillers, substances like Latisse, and laser skin treatments are all part of my armamentarium.
And then talk to me about droopy eyelids and eyebrows. I feel like over the last few years, I know people who have said, I'm sick and tired of looking tired. This is a problem that I'm sure you hear about all the time.
Yes, that is a very, very common problem and ubiquitous. Everyone has some degree of this. This is a classic patient who's got extra skin above the upper eyelids, some wrinkling and redundancy along the lower eyelids. The upper eyelids transmit sort of an anger, lower eyelids transmit fatigue. So when people look at you, they have an immediate impression of you based upon the appearance of your eyes.
Exactly.
With a laser, which I use as my surgical instrument of choice during this procedure, we can remove some of that extra skin, sculpt the tissues, and remodel them to allow some rejuvenation to occur relatively straightforward. So this is her afterwards. And if we look at them side by side, you can see that the skin on the upper eyelids has just been tailored back just a little bit, not a whole lot. And the bottom eyelids had some fat repositioning behind there to change the contour, and then the skin has been resurfaced.
Doctor, she looks beautiful, but the big important thing is natural.
Correct.
It doesn't look like she's had a lot of work done. She just looks well rested and younger.
Right. The laser on the bottom eyelids in particular, we do a resurfacing procedure, which is similar to the analogy of power washing your driveway. So what you're doing is you're stimulating new collagen underneath the skin to develop without cutting any skin out. So there's no stitches, there's no scarring that happens there. We just resurface the bottom eyelids, and it really just allows the body to heal it up in a natural way.
So it's still considered blepharoplasty, but you're not having to use a knife.
Correct.
Right.
Correct. I use a laser for everything.
Unbelievable.
It seals off blood vessels, so there's really no bleeding.
Wow.
And we have different, a better recovery period as a result. This is a classic gentleman. Obviously, an Asian eyelid is a different anatomy than a Caucasian eyelid. So using the laser allows me to sculpt the tissues while adhering to that unique anatomy. And by doing so, we're able to really open things up, create some youth, and just an overall healthy appearance. So he looks he's been rejuvenated, woken up, and can see a whole lot better also.
Exactly.
This
Older client.
Classic type of patient who's got both a cosmetic as well as a functional situation here. So she's got these tiny little visors. So if you and I were to put on tiny little micro baseball hats, that's what she's looking through.
Oh,
so
poor things. So it's affecting her peripheral vision?
Yes, that's what I mean by a functional problem. She can't see things out to the sides because she's got this little visor. So by using the laser, we can remove that extra skin, sculpt the tissues, and similar to the other patient, we resurfaced and repositioned some fatty tissue. And she's able to get a youthful result. Again, there was no incision, there was no scarring or sutures that were placed in those bottom eyelids.
This has to be so exciting for you when the lasers first started coming and you seeing the results of what it really can do without, again, having to go under the knife, having the hospital stay or doctor stay. Like, would you use anesthesia for this, or what's the process?
The anesthesia that we use for this, it's done as an outpatient procedure. I mean, you go in and you go out the same day. The anesthesia we use is just some sedation, which they put an IV in, which gives you medicine, just to make you relax. And I put local numbing medicine into the skin. You go home right afterwards. There's no patch. There's no bandage. Stitches in the upper eyelid stay in for about a week. And on the bottom eyelid, as I said, there's no stitches. The skin looks like you have a sunburn for about a week, and then after that, your body heals it up nicely.
Incredible. And if you are looking for other options that are skin rejuvenation, but not necessarily wanting that surgical procedure, you talked about them a little bit at the beginning. Go more in depth about how they can help give that youthful appearance.
Botox is extremely common now. Botox works as a neuromodulator, we call it. It's a fancy word which basically means that it changes the strength of a muscle's activity. And what it does is by decreasing the muscle strength, it stops it from pulling in wrinkles out above it. So it smooths and flattens the skin. Dermal fillers is sort of like putting putty into a crease.
Yeah.
We have creases commonly around the nose and the mouth, around the eyes, and dermal fillers can even that out.
Okay.
What I'm very excited about is this new technology that we deal with what's called a Cyton laser.
Different from the laser that you were using in
Correct.
the bleph. Okay.
This laser is what we call a non-ablative laser. So the blepharoplasty laser we talked about removes the surface of the skin and allows the body to heal. This particular laser focuses its energy beneath the surface of the skin where tiny blood vessels, pigment is deposited, and allows us to treat those situations a bit differently. These are some of the common problems that are used and treated by this laser. Age or sunspots, capillaries, redness. Rosacea is an inflammatory vascular condition.
Right.
So people get redness around the nose and the cheeks and the chin, and this laser really allows them to smooth that tissue out.
And I think we have some befores and afters there as well. Okay.
This is a classic patient who's got some skin modeling, some pigment changes, some tiny little vascular abnormalities. And if we do several treatments with this laser, we can clean up the skin quite nicely. So we look at them back to back again. It's the same patient. You can see this tiny little wrinkle here.
Right.
A little bit more pronounced there, so it does help flatten that.
Sure. But just the texture of her skin is completely different.
It allows us to modify the integrity of the skin very, very nicely. This patient underwent several treatments with this laser. This is not a one-shot deal.
Right.
Several treatments over the course of several weeks are needed for this because you can't focus that much energy at once because we need to maintain the decreased downtime.
Right.
Patients come in, they go home right after this. There's no anesthesia needed. There's some mild redness that they can cover up with makeup immediately.
Right.
And classically, they need about 3 to 5 treatments spaced about 3 or 4 weeks apart.
That's fantastic. I mean, it just incredible. And then that's another case of this
very
capillaries.
classic type of thing. These tiny little blood vessels that reside underneath the skin, classic positions underneath the nose, around the eyes, around the chin and the mouth. And again, after several treatments with this laser, we can basically wipe it clean. You can still see some tiny ones, but by and large, the improvement is really nice. Just
beautiful. And doctor, I hate that we're out of time. I mean, we could do an hour-long seminar about this. I guess the good news is they can call you for help, and I know you have a great offer for Atlanta and Company viewers.
Yes, we do. We're located at Thomas Eye Group, we have 7 offices located around the metro Atlanta area. I see patients out of our Lilburn office, our Swanee office, and our main office in Sandy Springs.
Okay.
And if we call and mention Atlanta and Company, we'll have an offer of a free cosmetic skin consultation and a 20% off all laser skin rejuvenation treatments for the first 25 callers.
I mean, that's just incredible. Doctor, thank you so much.
Thanks for having me.
Getting us all very excited about a new year, new you. Right? Good. Thank you. Great seeing you again.
You as well.
And Thomas Eye Group, as he just said, has 7 convenient locations. To take advantage of this great offer or to learn more about the Thomas Eye Group, give them a call right now. It's 844-ATL-RENEW. Or visit the website at thomaseye.com.